Welcome to another episode of Trial Site News. Myocarditis risk after COVID-19 mRNA vaccines. The WHO acknowledges the risk, although they stress it is rare. And now, even mainstream media outlets are finally starting to report on the issue. But critics say that the media is still downplaying it. So the question is, are they? Well, that, my friends, is the subject of today's episode. From Trial Site News, I am Adrian, and our episode is starting right now. So, the mainstream media is now starting to report on the potential risks of cardiovascular issues associated with the COVID-19 vaccines, namely the safety signal detected after hundreds of millions of doses have been administered throughout American society and beyond. Now, an important and key question here is, what is the risk level associated with the signals? Well, according to a recent piece written by Berkeley Loveless, Jr., the myocarditis side effects are rare, but real. Shocking. One such example of all of this is 22-year-old Davion Miller, who, due to a severe side effect associated with the Pfizer mRNA vaccine, found himself unconscious in his Detroit bathroom just a week after getting vaccinated. He was rushed to the Henry Ford West Bloomfield Hospital, and he has since struggled with bouts of fatigue, shortness of breath, and dizziness. After discovering the inflammation of the heart, Miller was counseled not to get a second dose from either Pfizer or Moderna. Now, as mentioned at the top of the episode, the overwhelming response from industry, government, and health system positions is that the condition is rare. Let's take the WHO, which posted on the subject back on October 27th of 2021. They said that the COVID-19 subcommittee of the WHO Global Advisory Committee on Vaccine Safety issued a statement regarding reports of myocarditis and pericarditis following COVID-19 mRNA vaccines. Cases of myocarditis and pericarditis, although rare, have occurred more often in younger men, adolescents, or young adults, and after the second dose, typically within a few days after vaccination with the COVID-19 mRNA vaccines. As of June 2021, U.S. VAERS surveillance data estimated crude reporting rates of 40.6 cases per million second doses among males of 4.2 cases per million among females aged 12 to 29 years of age. Current evidence suggests a likely causal association between myocarditis and the mRNA vaccine. But considering that we are now over a year later, and our data on the matter continues to grow, the question that keeps just popping up is just how rare are incidences of myocarditis and pericarditis associated with the COVID-19 mRNA vaccines, and what are the long-term consequences of these conditions? There have been thousands of reports of vaccine-related myocarditis or pericarditis via the CDC, mostly involving persons 18 years of age and under, and often male. Importantly, this cohort overall faces less risk from SARS-CoV-2 in general, compared to the elderly, persons with comorbidities, and pregnant women, etc. According to Loveless Jr., most of those who developed the condition have fully recovered, although research so far has only looked at how well they are doing after several months. And most concerning, some doctors have voiced aloud if it can cause permanent damage to the heart. Now, before delving into the current research investigating that very question, meaning the longevity of myocarditis, for example, an ongoing question involves the intensity of the signal. There are differences of opinions here. For example, a recent NBC News article reached out to the FDA to get some perspective from the regulatory agency responsible for overseeing medical products to protect the American public. The FDA wouldn't comment on the matter, declaring that there are ongoing studies sponsored by Pfizer and Moderna to investigate itself. However, a spokesperson did tell Loveless Jr. that the safety signals emanating from the use of the mRNA vaccines suggest that any incidence of myocarditis post-vaccination is, quote, very low. And yet, Florida's Surgeon General went out on a limb recently to direct the state not to recommend COVID-19 vaccination for younger people, where the signal is in fact higher based on a study that they commissioned. So, we ask again, what are the long-term effects? Well, most studies looking into the impact of COVID-19 vaccine-related myocarditis all but declare no risk as the condition healed in nearly all the persons that were diagnosed with the problem. But does myocarditis just heal, or are there long-term risks? And it appears that both Pfizer and Moderna have concerns about the long-term consequences. Otherwise, they wouldn't invest the capital and resources to conduct major clinical trials investigating the long-term impact of myocarditis in association with the COVID-19 vaccines, as reported by NBC. Interestingly, major health systems such as Johns Hopkins University have updated their definitions to include as a result of COVID-19, but not yet vaccination. However, the FDA package insert for Pfizer's COVID-19 vaccine Comirnaty delineates the concerns, albeit rate, involving myocarditis. For example, the FDA declares themselves that post-marketing data demonstrate increased risks of myocarditis and pericarditis, particularly within 7 days following the second dose. The observed risk is higher among males under 40 years of age than among females and older males. The observed risk is highest in males 12 through 17 years of age, although some cases required intensive care support. Available data from short-term follow-up suggest that most individuals have had resolution of symptoms with conservative management. Information is not yet available about potential long-term sequelae. The CDC has published considerations related to myocarditis and pericarditis after vaccination, including for vaccination of individuals with a history of myocarditis or pericarditis. And so, as part of the approval process, the FDA required pharmaceutical companies from Moderna to Pfizer to conduct research to better quantify the safety signals associated with the identified risk. For example, in the case of Moderna's Biological License Application, or BLA, the FDA required that the company lead studies to evaluate any long-term impacts associated with the COVID-19 vaccines, such as myocarditis. As NBC wrote in their article on the subject, they said that, quote, the first research in the U.S. is underway, tracking adverse health effects, if any, that may appear in years following a diagnosis of vaccine-associated heart problems. Moderna has already launched 2 trials, the most recent in September. Pfizer confirmed that at least one of its trials, which will include up to 500 teens and young adults under age 21, is slated to begin in the next couple of months, end quote. Meanwhile, Hadassah Medical Organization, an Israeli hospital, also launched a study to investigate the connection of myocarditis to the Pfizer vaccine. The study, NCT 05288-426, focuses on individual subjects that were diagnosed with post-vaccination myocarditis. The investigators are exploring the long-term impact on 150 patients who have been diagnosed with myocarditis or multisystem inflammatory syndrome, otherwise known as MIS, in a year following their diagnosis of myocarditis. And then we have the largest hospital in Denmark, which has launched a large population-wide, 35,000 subjects cohort study to evaluate the incidence of the cardiovascular condition in children aged 5 to 11 years of age after being vaccinated with one of the mRNA-based COVID-19 vaccines. And finally, the University of Colorado has also been conducting the MidVax study, investigating myocardial injury and dysfunction associated with mRNA COVID-19 vaccination. This small study in particular should have preliminary results soon. According to the NBC report, Pfizer, in collaboration with the Pediatric Heart Network, will launch a study monitoring youthful participants for 5 years. This study is led by University of Utah pediatrician Dr. Truong, which naturally we'll be keeping an eye on here at Trial Site News. So again, let's go back to the question. What are the actual risks of myocarditis and pericarditis associated with the mRNA-based COVID-19 vaccines generally, and with younger people in particular? How intense are the safety signals? And how many persons are actually at risk? What are the actual long-term risks associated with persons that are post-COVID-19 vaccine injured with these cardiovascular incidences? These are supremely important questions, my friends. People have the right to know. What will the truth actually look like? Will it turn out to be more of what the FDA has depicted as reality, meaning it's simply a rare side effect that has no lasting physical detriments? Or will it be what the Surgeon General of Florida has come to the conclusion of, that there is just too much risk and not enough benefit to recommend COVID-19 vaccines for people under the age of 30? Now, while most of the medical establishment would simply like this issue to go away, the actual science is still up in the air on the subject. And of course, we here at Trial Site News will continue to monitor the story as it continues to develop. And that, my friends, will bring our episode to a close once more. As always, thank you so much for joining me on the program today. From Trial Site News, I am Adrian, and I will see you all next time.